Let's just go back to that story now. The Health Minister, Dr. Zweli Mkhize, has acknowledged that the Ministerial Advisory Committee has agreed to reopen schools despite the stance of the World Health Organization that the timing may not have been right. Mkhize says communities have to learn to coexist with the virus, and the decision to reopen schools was not taken lightly. This after teachers' unions NATU, NEPTOSA and student organization COSAS joined SATU's call for schools to close amid the pandemic. We take the discussion further now. We joined via Skype by Professor Sithembiso Velaphi, who's the Head of Paediatrics at Chris Hani Baragwanath Academic Hospital. He's also the Associate Professor at the University of the Witwatersrand. Prof, good afternoon to you. Thank you so much for coming through.
Good afternoon.
Now, Prof, the World Health Organization says schools should only be opened in the context of low community transmission rates. Is this even achievable here in South Africa?
Yes, in terms of what the World Health Organization mentioned regarding the transmission, I think first one must look at what should one look at before recommending opening schools. I think there are three things that one should look at. The first one is to look at the rate of transmission in children. Number two is that if they do get infection, what is the severity of the disease? So I think that is the first component. The second component is to look at the non-pharmaceutical interventions. That means a distance between the students in the class, the hand sanitizers, the coughing etiquette, the use of mask. And then the third one is looking at the community transmission. I think while one understands what the World Health Organization says, I think one must look at the context at which one is looking at this infection. Currently, the schools are open in the country in terms of the grade 7 and the grade 12. And number two, we have seen what's happening in the country, in the province. So if one starts with the first one in terms of the transmission, the transmission rate in children is very low. And if you look at the transmission rate in the schools, that number is very low as compared to what they get from home in terms of the family. So the school, while they can get infection, is not the place where they get most of the infection. Most of the infection they get it from their homes or from the community.
All right.
So therefore, I think the definition of a low versus high transmission rate, it becomes relative depending where you are. All
right. So now, the calls that have been made by the unions within the education sector, do you think, are we as South Africans perhaps in a panic mode? Because as you explained it, Prof, that the transmission rate is very low. I do know that some studies have also shown that coronavirus doesn't generally make children as sick as us adults.
Yes, I mean, that is true. I mean, if you look at the children, they don't get sick as adults. So let's say, for example, let's look at the admissions. There are very low admission rates in children. So I was talking to my colleagues from KZN. They have seen some children who are positive. About 522 children had were positive for the coronavirus. Of those 522, 26 required admissions. And then to me, that suggests that in terms of the severity of the disease, that is very low. Now I'm talking at a local context, because we have been using the data from other countries, but now we've got information from home. And if you're looking at Western Cape, where they had high numbers, they had about, in Tygerberg, they had about 95 patients that were positive. And none of those patients died, and only few required admission. So the infection rate in children is very low. Number two, the severity of the disease is very mild.
But why is it the case, Prof? I was also looking at some numbers here from the National Institute of Communicable Diseases, which shows that less than 7% of all reported positive COVID-19 cases in the country, 7% are children. So why is it the case?
So I think from what we understand in terms of the scientific evidence is that this virus attaches to certain parts of the body or of the wall of the mucosa, what we call receptors. So when it attaches to that area in the lining of the airway and that receptor, that's how it leads to the damage. Now, it would appear that in children, those receptors are relatively low in numbers as compared to in adults. Number two, those receptors in children tend to be more in the upper airway rather than in the lungs, whereas in an adult it's much more in the lungs. Then it gets worse if the lungs are damaged or fibrosed from the previous infections. So therefore, having less receptors in the lungs, even if it gets there, it has less effect. That's one reason. The second reason is the response to the infection. When you have infection, the body responds in different ways. One of the ways it responds is that it produces certain chemicals that we call cytokines. And those chemical cytokines cause inflammation or damage in the body as it responds to the infection. So in the children, there are less cytokines produced than in adults. And of course, the other third reason could be that children tend to get a lot of viral infections. So it might be possible that there's some kind of cross immunity from those infections, that the child has infections, produces some antibodies or resistance against those infections. It's possible that resistance or those antibodies might have some effect towards coronavirus. So those are some of the possibilities in terms of why the children have less severe infection than in adults.
Very interesting. I wish we had more time, because some people believe that these children can become super spreaders of the virus since they don't necessarily display those severe symptoms, as you say. But we've run out of time, Prof. Thank you so much for coming through. Well, that's Professor Sithembiso Velaphi. He's an associate professor at the University of the Witwatersrand, also the head of Paediatrics at the Hani Baragwanath Academic Hospital. A quick ad break. See you right at the top.